Now we will move on to talk about the treatment of osteosarcoma. Surgery and chemotherapy afford the best chance for survival. With surgery alone, the 5-year survival is only 20%, but with surgery and chemotherapy for patients without metastases, survival approaches 70%. For the approximately 10% of patients with metastases at the time of presentation, a combination of surgery and chemotherapy has a much more sobering prognosis, with a 20% survival. Chemotherapy has become the mainstay of treatment for osteosarcomas because many patients have micrometastases. Currently, at many cancer centers, patients with osteosarcomas receive chemotherapy before and after limb-sparing surgery because such a regimen improves survival after surgery alone. The agents used with greatest success in combination chemotherapy include cisplatin, doxorubicin, ifosfamide, and cyclophosphamide, and high-dose methotrexate with leucovorin rescue. Going back to the 1970s, several oncologists began using 2 or more agents to treat osteosarcomas. By the 1980s, the drugs listed above had gained popularity for the treatment of osteosarcomas. The rationale for these drugs seems to have begun with their use in leukemia, a bone marrow tumor, and protocols have been refined by trial and error. And now to discuss some principles of cancer chemotherapy. Because cancer is caused by defects in which cell division and growth are out of control, and because DNA replication lies at the heart of cell division, the major targets of cancer chemotherapeutic agents include the following: disrupting the DNA molecule itself, interfering with the enzymes that work in tandem with DNA, such as the topoisomerases, and 3. Disable the mitotic apparatus, thereby blocking cell division. In the past, combination chemotherapy was considered a powerful approach because it would target different phases of the cell cycle, but now it is believed that combination chemotherapy is so effective because it triggers cell death through necrosis or apoptosis. Recall that necrosis causes irreversible damage to the cell membrane. Apoptosis, by contrast, is a tightly controlled process involving mitochondrial damage and release of caspases, which cause the cell to commit suicide. Thus, in the current view, much, but not all, of the effects of cancer drugs are to activate apoptosis via classic signal pathway. It is important to recognize that because cancer cells are abnormal host cells, they are still very much like host cells. In particular, tissues like bone marrow and the gastrointestinal tract that normally undergo rapid and constant replacement are at greatest risk for the adverse effects of what are essentially cell poisons. Moving on to discuss the drugs used to treat osteosarcoma, we're going to talk about the alkylating agents, which are cyclophosphamide and ifosfamide. Alkylating agents transfer their alkyl groups to DNA and other cellular components. Alkanes are hydrocarbons that contain only single bonds. Alkanes are also known as saturated compounds because these compounds contain the maximum number of hydrogen bonds that a carbon can bond with. These groups react with various negatively charged groups in the cell, including phosphate, sulfhydryl, amino, hydroxyl, and carboxyl groups. In the case of DNA, these alkylating agents usually add the alkyl group to the N7 position of guanine. Cyclophosphamide must be metabolized to 4-hydroxycyclophosphamide, the active form, which decomposes to other active agents, and acrolein. Acrolein is responsible for causing a chemical cystitis. Administration of 2-mercaptothenoesphonate or mesna is used to treat the cystitis. Cyclophosphamide is also associated with interstitial pneumonitis. As with other alkylating agents, Cyclophosphamide causes myelosuppression with potential life-threatening leukopenia, mucositis, alopecia, and gonadal dysfunction. Ifosfamide is an analog of cyclophosphamide that requires co-administration with mesna to avoid bladder injury. The anti-cancer properties of cisplatin were discovered by accident when it was observed that neutral platinum complexes inhibit cell division of E. coli. Cisplatin is believed to act as an alkylating agent binding DNA through formation of interstrand crosslinks. Cisplatin is able to kill cells in all stages of the cell cycle and is used to treat a wide range of solid tumors including osteosarcomas. Cisplatin is quite nephrotoxic and thus requires administration with adequate hydration. Cisplatin is also associated with peripheral neuropathy and causes intense vomiting, which can be ameliorated with prophylactic serotonin 5-HT3 antagonists like ondansetron. Anti-tumor antibiotics and topoisomerase poisons. Doxorubicin is a potent agent which is able to intercalate into double-stranded DNA, altering its structure and therefore its ability to replicate and interact with topoisomerases. Doxorubicin also produces reactive oxygen species ROS by accepting electrons into its ring system. These free radicals cause single-strand breaks and crosslinks in DNA. The side effects of doxorubicin include myelosuppression, mucositis, nausea, and alopecia. The most notorious adverse effects of doxorubicin is the occurrence of chronic cardiomyopathy and heart failure with doses over a key threshold of 550 milligrams per meter squared. This is the major limitation in the use of doxorubicin. Now let's move on to the antimetabolites. Methotrexate is a folic acid antagonist that inhibits dihydrofolate reductase, the enzyme that regenerates the reduced form of folate required for one carbon transfer, so essential for many intracellular biosynthetic reactions. Among these reactions is the formation of DTMP, which will be incorporated into DNA. High-dose methotrexate with leucovorin rescue several hours later has proved to be effective for osteosarcomas and hematopoietic neoplasms. The leucovorin protects normal tissues while allowing the toxicity of methotrexate to target the tumor. The side effects of methotrexate include myelosuppression, mucositis, and crystallization in the urine. And finally, we will add a few comments on this case. The patient underwent limb-sparing surgery followed by multiple cycles of combination chemotherapy. While the drug regimen proved to be arduous, 5 years later she is well and tumor-free.